Welcome back. This is Dr. Raghav with your OncoCare Advisor. We're talking about colon cancer in a series of posts. The next step was to talk about TNM, tumor, lymph node, metastasis, which determines the final stage. T means tumor, meaning when the tumor is located in the colon. To be honest, we are really not concerned about the actual size of the tumor. What we are concerned more about is how much it's penetrating through the wall of the colon. So let's take a step back. Now let's try to understand what does a colon wall looks like. So colon is like a pipe. In that pipe, this is the wall. So the wall is composed of about 4 layers. Mucosa, which is the most inner lining of it. Submucosa means it is the next layer after the mucosa. Then muscularis propria, meaning that it has the muscle layer that actually helps contracting the colon, but also has a lot of blood vessels and lymphatic channels that pass through that. And the 4th layer is serosa, which is the outer layer that kind of protects the colon. Unless we understand this, it's hard to understand the T part of the stage. So when we are trying to figure out what is the T stage, we are looking at, under the microscope, how much this tumor is penetrating through the wall. Remember, the whole wall of the colon is only about 3 to 5 millimeters thick at best. 5 millimeters, that's about that size. So if it's penetrating through the first wall, or if it's going through the second part of the wall, but it's in the middle there, or if it's penetrating through the third part of it, or it's penetrating through the entire wall and is outside the colon, that determines the tumor part of it. That means T1, T2, T3, T4. We determine that first, and then we determine the lymph nodes. That means when someone undergoes surgery, usually about at least 10 plus lymph nodes are removed in the vicinity of that colon. And when we check those lymph nodes under the microscope, depending on the number of lymph nodes determines the N part of the stage. So TN, if it is 1 lymph node, 5 lymph nodes, 10 lymph nodes, determines the N part of it. Metastasis is more from the scans if the cancer has spread to the liver or lungs or bones, etc. So just to summarize again, a colon cancer stage is determined by TNM, tumor, lymph node, metastasis. T is explained by the layers of the colon. Lymph node is by the number of lymph nodes that are involved. Metastasis, M, meaning if the cancer has spread anywhere. So once the final stage is determined, that helps us to understand what is the best way to approach the treatment. And not only that, there are few components we need to talk about. We'll see you again in the next post.